Colorectal cancer has been identified by Canadian Cancer Society as the third most commonly diagnosed cancer in Canada and the third leading cause of death from cancer in women in Canada. It's very important to let the public know the risk factors and teach them that early prevention and detection can reduce mortality. If we can control our diet and physical activity, the incidence of colorectal cancer can be reduced. Therefore, our study tried to educate the public regarding the relationships among healthy diet, physical activity, and colorectal cancer risk factors at an earlier age. The goal of our project was to initiate a culturally appropriate and language-friendly educational program related to colorectal cancer risk prevention for Chinese immigrant women.
It's been a real pleasure for me to work with my colleague, Dr. Sonia Lee, and Grace Ho from the South Riverdale Community Health Center on this important project.
When York University approaches a partnership, it is great.
In order to examine the efficacy of the educational program on participants' knowledge, we developed a 6-week workshop, 2 hours per week. 50 participants attended the program.
All of them are newcomers with language barrier and did not know anything about the healthcare system here.
In week 1, we introduced Ontario healthcare system and Canada's food guide to the participants. In week 2, we told them the relationship between unhealthy eating behaviors and cancer risk. In week 3, we did exercise demonstrations. We provided them how to prevent colorectal cancer and some screening methods. In week 5, we invited a dietitian and she did cooking demonstrations. And in week 6, the last week, we did a focus group discussion and a course evaluation. The result shows that our educational program is appropriate for Chinese women, especially when most of them have language difficulties.
教咗我哋做運動，仲有咧就即係話身體健康做運動就好有好處。
這個課程可以多開展一些，然後讓我們學到一些東西，然後可以有一些書面資料什麼，這樣的話就是學得會比較具體，
對身體有利益嘅，即係有好處嘅咁。我會繼續參與。
I would like to take this opportunity to thank Women's Exchange Project funded our research. South Riverdale Community Health Center offered their classroom for us. I also want to express my sincere thanks to all the participants in our study. Without them, this research cannot be done.